Hello everybody and welcome to the HacettepePathology.com Case of the Month series. So in this month I'm going to show you a core biopsy from a 45-year-old male patient from a periadrenal mass. So in a low power we see a spindle cell tumor with somewhat lots of bleeding, and it seems like in first glance you may think of a vascular tumor because of these lots of erythrocytes, and at the end of the biopsy we have more blood, but at the other cores we have these hypocellular areas with hyalinization around the vessel, as seen here, and more hypercellular areas of spindle cells, and more degenerative edematous areas like this here, and another cellular area with some hyperchromatic cells, as you see here. They look somewhat hyperchromatic and atypical. And when we look at the cells seems to be buckled. The nuclei are buckled, and we don't have any mitotic figures. And here again a hyalinized hypocellular area, and again another hypercellular area. But in this tumor, the most highlighting feature is the presence of hypocellular and hypercellular areas, spindle cell proliferation, and these hyalinized vessel with lots of blood. So actually you don't need so much immunos here, but if you think of an intra-abdominal tumor, you may consider dedifferentiated liposarcoma, sarcomatoid carcinoma, and leiomyosarcomas and GISTs. But in this case, the morphology speaks a lot more than immunohistochemistry. And here we have more degenerating areas. So we have these hypercellular and hypocellular areas and hypercellular areas. And we have these hyalinized vessels with lots of extravasated erythrocytes. So actually the morphology is pathognomonic and diagnostic for schwannoma. If you do a cytokeratin here, you may mess up with the diagnosis, because A1A3 cytokeratin may cross-react with GFAP and therefore may be focally positive. Here these atypical cells, hyperchromatic cells, may confuse the pathologist, but these type of degenerative atypia may be seen in ancient schwannomas. And of course, if these cells are not matched with the mitotic figure or necrosis, you should think about ancient changes in these type of biopsies. So we ordered NS100, and this is diffuse and homogeneous and diffuse and strong positive. So the diagnosis is schwannoma. Maybe in this case the most relevant differential diagnosis may be PH80, pleomorphic hyalinizing angiectatic tumor, but the clinics and the location is not suitable, and S100 just resolves this diagnostic challenge. Thank you very much.